Having a strong set of values will help you name what matters to you as a clinician and as a leader, even if you're leading just one patient interaction at a time. Leading with values means your treatment planning is consistent, even under pressure, and consistency is what builds long-term trust. Exploring your values early can save you years of frustration, because when your goals are aligned with your values, you might find yourself facing some challenges, but they'll feel like the right challenges for you to be tackling.
Good dentistry doesn't come from running yourself into the ground. It comes from being intentional about understanding who you are at your core and also how you grow. So wherever you are, student, associate, owner, leader, just know that you're allowed to define success on your own terms.
One of the hardest leadership lessons for me has been learning how to work effectively with people who are very Welcome back to Project Confidence. I'm Diana.
And I'm Amrita. And today we're doing a little introspection.
That's right. We're taking an honest look in the mirror and talking about self-assessment, mindset, and values. 3 things that sound abstract until you realize they quietly dictate every decision you make as a doctor.
You know, we've covered a lot of different topics on this podcast, and we realized that most of it has been personal reflection, like talking about our worst experiences on the job or traumatic memories from dental school we tried to suppress.
People might think we're joking about that last part, but I actually completely forgot that there was a class called OMPR in dental school until a recent grad asked me if I had ever failed it.
Oh my God, you're right. Wait, what did that stand for again?
Oral and maxillofacial pathology and radiology.
This was a class where like 80 people failed the competency on the first try, right?
Yes, I think they had to have like 3 rounds of remediation for our entire class because it was so difficult. And as someone who now teaches at a dental school, I get that they try to make it difficult on purpose so that you have to go back again and again and really engage with and learn the material. But unfortunately, all it accomplished was giving me low-key PTSD so that my brain completely blocked out any memory of the experience and all of the material after it was over. So yeah, good job, guys.
So today, we're going to dive deeper into reflection and talk about the power of self-assessment, setting the right goals, and defining your own set of values.
And how it can help to set you up for success in your career. So let's start with what we mean when we say self-assessment. It's not the kind that you remember from dental school that comes with a rubric and a score.
Right. It's the kind where you pause and ask, wait, who am I and what am I even doing with my life?
A lot of people who are finishing up dental school or just starting out in their careers forget how important this is because you've likely spent the last 3 or 4 years of your life, or maybe more, being hyper-focused on everything you have to do to graduate.
And then suddenly, once you've checked every box and that diploma is finally yours and there's nothing left to do on your to-do list to become a dentist, that's where a lot of doctors find themselves feeling kind of adrift or disillusioned once there's nobody telling them what they have to do next.
Exactly. There's like this mini existential crisis that sets in for a lot of us once you finally achieve the thing you've worked for your whole life. It's something that actually a lot of Olympic medalists have talked about experiencing after winning the ultimate prize in their sport.
Wait, really?
Oh, for sure. Michael Phelps is probably the most famous and most recent Olympian who said over and over in interviews that after becoming the most decorated Olympic athlete in history, he sank into this really deep depression, or he didn't even want to be alive. But it's actually quite prevalent in competitive sports at that ultra elite level where your training totally consumes the better part of your prime years. And then once it's over, people are like, well, now what am I supposed to do with myself? Like, what was the point of all this? Where am I supposed to go from here?
And that makes sense that there would be a lot of parallels there between competitive sports and training to be a doctor because both paths require so much discipline and stamina and sacrifice. It's easier to forget why you wanted it so badly, even after you get the thing that you wanted forever.
100%.
All of this is to say, if you don't stop to assess yourself and what's important to you, you could wind up chasing goals that feel like they don't belong to you or maybe have no purpose. Then you'll wonder why you're miserable in a job that you worked your whole adult life for.
So let's talk about what self-assessment is in the context of setting yourself up for success in your career. Self-assessment is about understanding what energizes you, what drains you, what you're naturally good at, and then where you genuinely struggle.
And struggling doesn't mean that there's something wrong with you. It means you're human.
But if you try to ignore it, that's how burnout and career disillusionment starts to creep in.
Okay. So if someone wants to conduct a self-assessment, where do they even start? Because telling someone just take time to reflect is useless advice if no one tells you how.
You're absolutely right. It's like this super vague directive, like when lifestyle influencers say that you need to start your day by setting your intention. Like, what does that even mean? My intention is to drink coffee, go to work, and hopefully make it through the day without having to file any incident reports.
Don't forget to stay hydrated with your emotional support water bottle.
Well, that's what the coffee is for.
Let's try to distill self assessment down to simple, easy to digest steps that literally anyone can do, whether they're a practice owner, associate, or even dental student. At the end of the day, in your office, in clinic, or at school, ask yourself 3 basic questions. 1, what moments gave me energy today? 2, what moments depleted me? And 3, where did I feel most like myself?
This is a great exercise because you're not asking yourself stuff like, well, what procedures did you do today? Or how many patients did you see?
Because dentistry loves to measure output.
Exactly. And sure, those metrics matter, but they don't tell the whole story. Two people can have the exact same procedure done and walk away feeling completely different about it.
One person's like, that was awesome. And the other's like, I need to lie down in a dark room.
And that difference is data. When something gives you energy, that's information about alignment. And when something drains you, that's information about strain, not failure.
And I want to be clear, depleted doesn't mean that you're bad at it.
Yes, it just means that it costs you more. And if you ignore that long enough, it shows up as burnout, resentment, or feeling stuck, even if on paper everything looks fine.
The third question, where did I feel most like myself, is my favorite because it cuts through the noise.
I love that one too, because that's often where your values are quietly showing up. It might be in patient communication or teaching, problem solving, or leading a team, sometimes in moments you wouldn't expect.
And what's wild is those moments don't always come with the biggest paycheck or the most prestige.
Right, but they're moments that tend to be sustainable. Over time, patterns will start to emerge if you actually pay attention.
So this isn't a one-day thing. This is like collecting receipts. You're gathering evidence about yourself, and once you have that, you can start making decisions. And those decisions are more intentional about your schedule, your career path, even how you show up day to day. Because self-assessment isn't about judging yourself, it's about understanding yourself.
And that understanding is what gives you agency. You stop defaulting into choices and start choosing with clarity.
Have you done formal self-assessments at all as part of your job?
You know, I actually have because I've done a lot of formal leadership training, both at my institution and then as part of the American Dental Education Association, ADEA. And the assessment tool that most of these programs make people do when they want to embark on this self-reflection journey is a DISC assessment. I've probably done a DISC assessment 5 or 6 times now. Have you done this?
Yep, once or twice.
Okay, so if you've never heard of this, DISC assessment is a behavioral self-assessment tool that describes how people tend to communicate, make decisions, and respond to challenges. It doesn't measure intelligence, skills, or personality types, but instead it highlights observable behavior patterns across 4 different styles. So dominance, D, influence, I, steadiness or steadfastness, S, and conscientiousness, C.
And it's actually really easy to access this and conduct a DISC assessment on yourself at 0 cost.
Yes, there's tons of free online DISC assessments you can do. Just Google it, DISC, and it's really pain-free. Depending on how in-depth the version you find is, it'll probably take you somewhere between 10 to 15 minutes on average to complete, and then you'll have some pretty detailed feedback with your results.
So when you did yours, what was the outcome?
On my last 2 DISC assessments, I came out almost perfectly split, about 50% D, 50% I.
Which tracks, you're decisive, and you want everyone to feel good about the decision.
So for anyone listening, that means I have a strong dominant side, like I'm comfortable making decisions, moving things forward, setting direction. Textbook, firstborn, Asian daughter energy.
You're not afraid to say, okay, here's what we're doing, especially in clinic.
But the I, the influence side, is just as strong. So I care deeply about relationships and morale and how people experience working with me.
Which is why people, especially your students, trust you. They know you're not just pushing an agenda, you're bringing them with you.
That combination has been, kind of a strength in dentistry and education. I can move systems forward, I can advocate for change, and still build buy-in with my students and staff and faculty.
But let's be real, there's a downside to this, right?
Oh, absolutely. When D and I are both high, it's easy to take on too much. Like I can move fast and say yes way too often, and that can lead up to burnout if I'm not careful. And then another challenge is that my urgency, that D side, can sometimes come across as intensity, even when my intention is to support.
Which is why self-awareness matters, because impact and intention aren't the same thing.
Exactly. Knowing my DISC profile helps me to pause and ask, okay, do I really need to push this right now, or do I need to pause and listen?
And that's leadership, not changing who you are, but knowing when to flex.
That's why self-assessment tools like DISC aren't about labels. They're mirrors. They show you how you naturally lead and where you need to be a little bit more intentional.
Especially in dentistry, where your leadership style affects patients, students, and entire teams.
It's become such a helpful and informative tool that a lot of these dental consultants, the ones who charge you tens of thousands to help you figure out why you or your practice isn't as profitable as you want it it to be. They start off by telling all of their clients to not only do a disc assessment on themselves, but also have all of their existing team members do them and make it part of the interviewing process when they hire new staff or associates.
That would provide a lot of insight to me as a practice owner because if I know where my strengths and weaknesses are, I can consciously hire people with complementary styles and strengths into the right roles and surround myself with a team that balances me and figure out how to get them to perform at their best.
Exactly, because depending on what you're like as a leader and a clinician, you want to build a team that covers all of your blind spots, but also aligns with how you want to practice and serve your patients. So, one of the hardest leadership lessons for me has been learning how to work effectively with people who are very S dominant or C dominant on disc.
Which makes sense because they move at a totally different speed than you.
Yeah, as someone who's high D and I tend to prioritize momentum, decisions, and just getting things into action. I'm comfortable with the ambiguity.
Meanwhile, your S&C teammates are like, can we slow down and make sure this won't blow up later?
And early on, I will be honest, I interpreted that as resistance or just lack of urgency. The analogy that I like to make here is, okay, let's pretend that Earth is under attack by aliens and we all need to get to safety or we're all going to die. So I'm the person who's going to be like, all right, everybody get into my spaceship now. And meanwhile, there are people that I work with and people in my own family or friend circle who would be like, oh my God, I need to freak out about this. Also, where are we going? Wait, maybe we should stay and try to fight them or reason with them. Or maybe it wouldn't be so bad if we just give up and live under their alien regime. And also, why does it have to be your spaceship? Why can't it be my spaceship? And I'm just get in the goddamn spaceship. You're wasting time with your stupid questions.
I'd be the exact same way, honestly.
I mean, that's a big part of why we're friends, right? I'd get in your spaceship.
Same.
What I eventually realized is that the people who are more S or C dominant, more steady and conscientious, they're not always trying to slow things down just to be annoying. They're trying to make things look right, and they're worried that being impulsive or making quick decisions will backfire in the long run.
And to be honest, that's fair. Not every decision in dentistry and in business should be made quickly. And not every patient is going to respond well to being pressured to make a decision on the spot, even when you're ready to move forward with treatment today.
S dominant people value stability, harmony, and predictability, and C dominant people value accuracy, data, and process.
That's the reason systems don't quietly collapse.
Exactly. In dentistry, especially, those qualities are critical. S dominant team members create trust with your patients and teams, and C dominant team members protect the quality, safety, and consistency of the work that you do. Once I saw that, my job as a leader shifted from asking myself, well, why aren't they moving faster? To, okay, how do I bring out their strengths at the right moment?
That's a really big mindset shift.
It meant slowing down when precision mattered and looping those C-dominant team members in early when we needed structure and relying on S-dominant colleagues during moments of change or conflict because that helps to stabilize the team.
You stopped trying to turn everyone into a mini you.
That's right. And that changed everything. Leadership became less about control and more about orchestration.
Which honestly is how you build a team that actually works, especially in a high-stakes environment like dentistry.
Self-assessment helped me see my own defaults, and that awareness made space for me to truly value how different styles contribute to better outcomes.
Okay, so let's say you've done the self-assessment, you've taken the quiz, maybe you've journaled, maybe you've even had a mini existential crisis. You know your strengths, you know your weaknesses. Now what?
Yeah, because this is where people get stuck. They learn more about themselves and then they just sit with it, or they turn into self-criticism instead of self-awareness.
Exactly. So the first step after a self-assessment isn't now fix everything. It's asking, how does this actually show up in how I practice dentistry? What goals can I set for myself now that I've taken an honest look in the mirror? And how is this going to impact how I lead my team and guide patients to accept my recommendations?
One thing I always tell people is don't label strengths and weaknesses as good or bad. They're just information. A weakness isn't a character flaw, it's a data point. And once you see it as data, you can make intentional adjustments. Like if you know you tend to avoid confrontation, you can prepare scripts for tough patient conversations instead of just winging it.
That's right, because being an effective dentist isn't about never feeling uncomfortable. It's about not letting discomfort compromise care or your sanity.
Another big piece of knowing where not to force yourself is if self-assessment shows that you're not energized by multitasking. Maybe you need tighter systems or better delegation, because self-aware dentists build environments that support their strengths and buffer their blind spots.
And that's how burnout gets prevented. You stop trying to be a version of a dentist that doesn't actually fit you. When you practice in alignment with who you are, you show up calmer, more confident, and more present, and patients feel safer.
So the real question after a self-assessment isn't what's wrong with me, but it's how do I practice dentistry on purpose with what I know now? Because self-assessment isn't about becoming someone else. It's about becoming a more effective, grounded version of the dentist you already are.
And once you have that clarity, once you actually understand how you operate as a person and as a dentist, the next step is to start setting goals for yourself.
Yeah, because self-awareness without direction just turns into rumination.
Exactly. Insight is powerful, but it needs somewhere to go. That's where these goals come in.
And I want to be really clear here. Goal setting is not just for practice owners or people who already have it all figured out, because no one does. You need goals most when you're early in your career. So whether you're a dental student or a new grad bouncing between offices or an associate who doesn't control the schedule or the systems, you still need to give yourself something to work towards that isn't just the dollar amount for a billable procedure. Because otherwise, you're just reacting to whatever environment that you're in.
And dentistry has a way of filling the vacuum if you don't decide what you're working toward. Production targets, other people's expectations, office cultures that may or may not align with you. Goals give you an internal compass. They help you evaluate, is this experience moving me closer to the dentist I want to become or not?
Even if the goal is simple, like this year, I want to get really confident with managing black triangles, or I want to improve how I communicate my treatment plans, or it could be, I just want to figure out what kind of practice environment actually supports me.
And for students, your goal does not have to be, I need to figure out exactly what I want to do for the next 30 years. Start with, let me figure out what kind of procedures I'm most excited about and make me want to learn more.
I actually tell my dental students about 6 or 7 months, 6, 7, sorry, okay, 6 or 7 months in that they need to start setting daily, weekly, and monthly goals for themselves to prevent hitting a mental wall in clinic. Like you can actually see it happen to students once they've gotten past learning how to schedule the appointments and they're able to finish a procedure in one session. There's this rut that they kind of tend to find themselves in where they're just showing up to clinic and then they go through the motions of doing dentistry, but they're not actually deriving any satisfaction from what they're doing. And the same can happen to you after graduation or even several years into practice ownership.
What kind of goals do you usually recommend when someone's still learning how to be a dentist?
Small, realistic, and achievable goals are best, but something that nudges you just a little past your comfort zone is best because it keeps things fresh and interesting. So, for instance, I'll tell my students, let's take an emergency walk-in patient, but see if you can convince them to convert their appointment into a comprehensive exam. If that patient's not in a great deal of pain and there's no true emergency situation brewing. And then whether they're able to or not, we then devote some time to exploring different approaches they could have taken and then where those different strategies might have led.
That's a great way to gain confidence as a beginner dentist, especially if you have the benefit of a safety net like an instructor or a mentor that can coach you through that entire process. Without goals, every task kind of feels random. But with goals, I think everything, all the tasks become a learning opportunity.
And then when your goals are informed by self-assessment, they're way more practical.
You then can stop asking, why can't I keep up like everyone else is? And start asking, what systems or environment help me do my best work and perform my best?
That's how you move from surviving dentistry to intentionally building a career in it, no matter where you're starting from. Amri, what's a dentistry goal that you've set for yourself lately?
I'm always looking to get better at planning and doing more complex crown and bridge cases, so fixed pros for sure. How about you?
As far as dentistry goes, I'm actually working on revisiting endo again so that I can safely and confidently lead my students through a molar pulpotomy if our endo faculty isn't there. I actually haven't done a root canal from start to finish in like a decade, but I want them to be able to get a patient out of pain if an endodontist can't see them for like another week or two.
That's so great of you.
I just really don't like sending people away when they're in distress, especially if we might be their only option as far as providers go.
Me neither. Did you ever think you'd be doing endo again?
Nope. I swore it off years ago because I just wasn't doing it as fast as I know my endo friendos can do RCTs. And when I really looked at how I was using my time in practice, I realized, I'd rather be doing 2 or 3 crown preps or final impressions on my implant patients in the time that it takes me to do just one root canal. But because making sure that my students graduate with this skill set is so important to me, how I practice dentistry is going to be expanding again. And this time around, I actually feel good about this decision rather than feeling like I've been forced into it.
And another really important point that we need to make here is that it's perfectly normal and actually expected that your goals are going to change over time. As you gain more experience and more exposure to patient care, team dynamics, and practice management, it's inevitable that how you feel about your workflows, how you feel about your priorities, and the things that you enjoy doing are going to probably evolve too.
Correct. And if you recognize that there's a shift in how you feel towards your work, your team, your environment, it's important not to beat yourself up about it because Nobody's saying you have to practice dentistry the exact same way for the rest of your career. Your mindset is allowed to evolve with your skill set. It would be weird if it didn't.
And that shift alone can change how satisfied you feel in your job, because when your goals are aligned with who you actually are or who you're becoming, your effort starts to feel purposeful. Kind of instead of exhausting and random, it affects how you choose jobs, how you structure your schedule, how you engage with patients, and even how you handle setbacks.
And it's why two dentists in the same practice can have completely different experiences. One might feel constantly depleted, while the other feels challenged but fulfilled, often because one is working against their natural strengths and the other is working with them. So self-assessment helps you recognize that before that resentment or regret sets in.
And when you use that insight to set intentional goals, you create a career that feels authentic to you, that you can be proud of. And once you start articulating all of those goals, personal and professional, the next step is to do a timeout and make sure that they align with your values.
Exactly. Before adding more goals, it's worth pausing and asking, what do I want to stand for, like in how I practice dentistry? Values are like a filter. They help you decide what's worth saying yes to, and just as importantly, what's worth saying no to.
People might hear the word values and think it sounds kind of contrived. But in dentistry, values show up in how you treatment plan, how you talk to patients, and how you lead a team, how you handle pressure and production and time constraints.
Anna Quinlan once said in a graduation speech at Barnard College, you must have the courage to embrace the right things and say no to the wrong things, even if you're the only one who seems to know the difference. I think about that a lot when I'm struggling to figure out the right thing to do in a difficult situation, or when I'm being pressured to do something, but my gut is telling me, no, 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 get out now.
And if one of your core values is patient-centered care, that's going to guide you in how you approach an aggressive treatment plan, even if the numbers say otherwise, or if even everyone around you is pushing you to upsell treatment. Or if mentorship is a value, you're going to feel miserable in an environment where you're expected to figure everything out alone, maybe with an absentee owner.
And this applies whether you're a student, an associate, or a leader with a title. Values shouldn't be something you wait to define until you're established. In fact, exploring your values early can save you years of frustration, because when your goals are aligned with your values, you might find yourself facing some challenges, but they'll feel like the right challenges for you to be tackling.
That's right. You can be tired, challenged, or even stretched and still feel grounded if your work matches what you care about.
Having a strong set of values will help you name what matters to you as a clinician and as a leader, even if you're leading just one patient interaction at a time.
So let's make this really tangible, because values aren't just something you write in a journal.
Amrit, what values guide how you practice dentistry and run an office?
Empathy and ethics. Being empathetic, I think, is so important, especially in the team environments that we work in. But also, you have to be able to sleep at night. So the treatment you recommend may not be what someone else recommends. And the way you run your practice may be totally different than the way the person down the street does. But that's okay. It just needs to feel right for you. I think a lot of this is just treating others how you'd want to be treated. It really is that simple. How about you?
I don't know what word you would use to describe this, but something that I always default to when I make treatment recommendations to patients is that I will always tell them what treatment I would want for them if they were my mom or my brother or my own kid or for myself. And a lot of times it's not even going to be the most expensive option or the most aesthetic option, right? Like I spent a significant amount of time in my practice reminding them that I'm presenting every possible option to them because that's my job. But no treatment is always an option too. And sometimes that's going to be the best option for them. I just don't think that you can ever go wrong with telling a patient what your personal preference would be and explaining why you'd feel that way, because that's also a chance to humanize this profession, kind of let them see you beyond the white coat and connect with you as a person or a parent. What would you call that? Authenticity?
Yeah, I think so.
I hate to call it that because I think people have abused that word so much, but if that's being authentic, then, well, guilty. But this is what we mean by values-driven care. Your values show up immediately in treatment planning and how you practice every time. The moment you're deciding what to recommend, how many options to present, or how much time you spend explaining, you're practicing your values.
And if one of your core values is integrity, that might mean recommending a more conservative option, even when a more aggressive one would be faster or more profitable. Or being honest when a patient asks if you can do it and you have to tell them that maybe you're not the best one to do that procedure yet, which takes courage, but patients feel that.
They really do. Trust isn't going to be built on perfection, it's built on transparency.
When your values are clear, your treatment plans become easier to explain because they're rooted in the why and not just the what. Patients can sense when you're rushing or when you're trying to sell them something, but they can also sense when you're grounded and genuinely thinking about their best interest. And that's huge for patient trust, especially for people who are anxious or have had previous bad experiences or feel vulnerable in the chair.
And if one of your values is respect, then that shows up in how you talk with patients and not at them. You invite questions, you normalize hesitation, you give them space to decide. And ironically, that's often when patients say yes, because trust makes acceptance easier.
If accountability is a value, you own your complications early. You don't deflect, you don't disappear, and patients forgive mistakes more readily when they trust your intentions.
Leading with values means your treatment planning is consistent, even under pressure. And consistency is what builds long-term trust, not just with patients, but with your team. And that's what makes you look like not just a competent dentist, but one that people feel that they can trust and refer their friends and family to.
So if we zoom out for a second, this whole conversation really started with one simple idea: paying attention to who you are, how you work, what gives you energy, and what quietly takes it away.
Self-assessment gives you awareness, goals give you direction, and then values give you meaning. So when those three are aligned, dentistry stops feeling like something that's happening to you. It becomes something that you are actively shaping.
Right, you start to make more intentional choices in how you learn, how you treatment plan, how you work with your patients, and lead your team.
And then you stop measuring success not only by speed and production or what everyone else is doing, and instead you start asking, does this really reflect the kind of dentist that I want to be?
And the truth is that dentistry will always be demanding, but it doesn't have to feel disorienting or misaligned, because when you know yourself, when you set thoughtful goals, and you practice in line with your values, you can build trust with patients, confidence in yourself, and a career that can actually last.
And this isn't about having it all figured out. It's about checking in with yourself over and over throughout your career, because the most fulfilled dentists we know aren't the ones who are certain that they did everything 100% right 100% of the time.
And the reason all of this matters isn't just personal fulfillment. It directly impacts how you show up for your patients, because patients feel it when you're misaligned or burned out.
When your goals and strengths are aligned, you're more present, more confident, and more thoughtful in patient care.
That's right, you're not rushing, second guessing, or mentally checked out.
So self-assessment can help you design a practice style that supports excellence, not just productivity. And that's when patient trust, outcomes, and satisfaction will really improve.
Good dentistry doesn't come from running yourself into the ground. It comes from being intentional about understanding who you are at your core and also how you grow. So wherever you are, student, associate, owner, leader, just know that you're allowed to define success on your own terms, and you're allowed to evolve.
Because dentistry isn't just what you do. It's who you are and what you stand for when you practice it on purpose.
Thanks for listening to Project Confidence. Remember to like, subscribe, and follow us on Instagram at Project Confidence.
See you next time.
Bye.
Bye.